What is the link between pap smear and HPV? Imagine catching a silent virus before it causes trouble. That's what screening tests like the pap smear and HPV test aim to do. They work together to spot early signs of cervical health issues. The pap smear, also called a pap test, looks at cells scraped from the cervix under a microscope. It checks for abnormal or precancerous changes in those cells. These changes often happen because of an infection with human papillomavirus, or HPV. HPV is a very common virus transmitted through sexual contact. Most sexually active people will get HPV at some point, but it usually clears up on its own. However, some high-risk types of HPV can cause changes in cervical cells that might turn into cancer if not caught early. That's where the HPV test comes in. It detects the actual presence of the virus's DNA or RNA in cervical cells. If HPV is found, especially the high-risk types, it means there's a chance those cells could become abnormal over time. The combination of the pap smear and HPV testing is powerful because it helps identify women who might be at higher risk for developing cervical cancer. When both tests are done together, called co-testing, the chance of catching problems early increases significantly. This is especially important because many HPV infections are temporary and don't cause lasting damage. But persistent infection with high-risk HPV types can lead to cervical dysplasia, which are precancerous changes that need medical attention. Regular screening with pap smears and HPV tests is vital because it allows healthcare providers to monitor cervical health over time. If abnormal cells are found, further tests or treatments can prevent the development of cervical cancer. The link between these two tests is that the pap smear shows the cellular effects of HPV infection, while the HPV test confirms whether the virus is present. They are like two sides of the same coin, working together to protect women's health. This approach has proven to be very effective in reducing the incidence and mortality of cervical cancer worldwide. Remember, maintaining regular screening schedules and consulting your healthcare provider are key steps in early detection and prevention. It's always best to get personalized advice tailored to your health history and risk factors.